What issues should we be thinking about and planning for as we look at the future of aging? That's the multifaceted topic Dr. Peter Whitehouse addressed during his presentation at Conversations at the Crossroads, the 2013 Joan Berkley Bioethics Symposium. Dr. Whitehouse is a professor at Case Western Reserve University and one of the foremost Alzheimer's experts in the world. His pioneering work led him to a better understanding of how the brain is affected by what he used to call Alzheimer's disease and to the development of drugs to treat the condition. His most recent work involves ethics, integrative healthcare, and quality of life. Dr. Whitehouse, thank you for joining us on the Bioethics channel. Welcome. I was intrigued with your presentation this morning when you began with the anecdote about your near-death experience. Tell me about that experience and how it's informed your thinking about the future of aging.
And I've always felt that one's own personal experiences ought to inform one's life as a person, as a physician, as an academic. And so it was, of course, just serendipitous that this occurred shortly before coming to give this talk. But what I'd been asked to do was to talk about general issues around aging and death and life so that the physicians and healthcare providers this afternoon can talk about their own individual experiences. So I thought I'd put my experience on the table. There are many things to learn from that, one of which was the rather serious-minded physician who was the last physician who saw me before I was discharged, who reminded me that I was a pretty healthy 64-year-old in general, despite that condition that was partly related to a blood clot, partly related to traveling. But at 64, this was a critical time where I need to really look at taking care of myself better, because from here on out, it becomes more challenging to keep active and keep the fragility of aging away. So that was what I took it to heart.
How well are we digesting these things at this point in time?
I think the human species is challenged by the complexity of the modern world and by its inability to think beyond the last quarter, the business quarter, the last year. I like the indigenous people's 7 generations. You should think about a problem in the context of 3 generations past and the history of how you came to be where you are, and also the consequences of your actions 3 generations hence. In actual fact, we almost have to be thinking 17 generations, 70 generations, because the consequences of our behavior and its effect on our planet today have charted a course that is going to be very hard to change. And it's just very hard for us to imagine that kind of timescale and that kind of geography of connectedness that the world is all about.
You had spoken about this idea of successful aging. What exactly is that?
I don't like successful aging because it tends to say, well, if you're not successful, what does that mean? And also success, we tend to think of in association with perhaps values that are more monetary or consumerism. You've successfully earned enough money or whatever. So to me, there's a dimension to aging that has to be taken away from this focus on consumerism and on money as measures of success. To me, the challenge in this world is to think of success and successful aging as more than just kind of material success, but something else.
From your vantage point, what do you think needs to happen to improve the lives of seniors?
One of the things that has to happen is, as Dwight Eisenhower said, sometimes if you are facing a challenge, you need to make it a bigger challenge or a bigger problem. So I don't think we can look at the quality of lives of elders in isolation as a problem to be fixed without thinking about kids and future generations of elders. But I do think that we have to challenge the value structure. This is, as my mentor in bioethics said, bioethics is a bridge to the future. But we've got to figure out how to not just think that money and intellect are going to solve problems. This is an issue of values. It's an issue of relationships. And so we really have to change attitudes about our relationships to each other and frankly recognize our animal backgrounds. Yes, we're a special species, but we're also basically living creatures that should have the wisdom to recognize our limitations.
How much of this are people actually grasping, and what's it going to take for people to understand what's really going on?
The politics of disease are, in particular in this country, are very strong. Everybody wants a piece of the NIH pie. To a certain extent, they also want a piece of healthcare reform. So we're organized around these disease advocacy groups that are allied with disease, I'm going to use a strong word, mongering drug companies who want to make things simple, because if they don't make things simple, they can't get politicians to give money to it, and they can't generate the kind of consistent social pressure to have people address the problem. So we're not getting it. I mean, for me, it's a very simple thing to say. Before anything else, a disease is a label. It's a label that some doctor usually came up with, but it's a label that changes. And it's not a label that we should allow doctors to come up with by themselves. Let's give one example of where we've made huge progresses in our lifetimes, and that's homosexuality. In 1973, the American Psychiatric Association, in their wisdom, declared that it was no longer considered a disease. Well, we've seen rapid advances, for example, in attitudes towards gay marriage that reflect a huge change in attitude from something that used to be considered a disease to something that now is considered part of the variation in human behavior. So there is hope, and the baby boomers are going to ask people to think of aging and brain aging differently, and I think they may actually create a change in the way we're thinking about things.
One of the projects you mentioned in relation to storytelling is the Intergenerational School. Tell me about that project and the role that storytelling plays.
This has to be my most passionate project. You know, my wife and I started it together. She's the principal of the school. She's a developmental psychologist. So an intergenerational school is a place where you break down the artificial boundaries around somebody being a certain age in a certain classroom. So it is chartered by the state of Ohio. It is the highest performing charter school in Ohio. And we focus on kids, elementary kids, age 5 to 15, let's say. But in that space, we have undergraduates, professional students, and elders. And the signature program is reading mentoring, where one-on-one relationships are formed between an elder and a student. Actually, it's usually with a co-class, so that the class gets to know the elder. And it's all about the elder telling stories from their lives, listening to the kids telling stories based on photographs or awards, and then sharing our rich intergenerational library connection of books that celebrate kids and elders working together. And we've done a randomized control study with qualitative research demonstrating that when the elders come and work with the kids, they do have a sense of purpose and a sense of usefulness, and they feel less stressed, and there is even suggestions that it might affect their thinking abilities. So this is an illustration of us trying to take one population, and we have at any one time perhaps half a dozen people who come to the school to read with the kids, and many more people with dementia that our kids visit in long-term care facilities. But that's a particularly challenging population to say the school can serve them in ways that are helpful to them, and I think we've demonstrated that it does.
You had told a wonderful story about the Volunteer of the Year at the school. Can you retell that story for me and share the impact that it had?
Well, I tell this story a lot because it had an impact on me. This woman was one of several hundred volunteers that were eligible for the Volunteer of the Year award, which we give every year in our school. And with that number, it's, you know, you have to, we have lots of awards, but this is the kind of pinnacle, the Volunteer of the Year. And while waiting to get this award, this woman turned to her daughter, who was with her, and said, "Why am I getting this award? And the daughter said, because you come here every week and you volunteer and read to the children and they love you. And this person looked at her daughter and said, I do? As if, quite accurately, to signal that she had forgotten that she actually comes there every week, because her recent memory problem, her dementia, meant that she couldn't remember that she was a volunteer. But obviously, in the moment with the child, she was present, she was engaged, and she was loved, and showed her love for them, and that's why she got the award. So it's a very powerful story for me, because it says that this is somebody who could have been discarded. This is somebody who could have been made useless. And in the context of the school, she achieved this recognition as the Volunteer of the Year award. And that story fits into other stories, like the people with dementia who told stories to the kid about saving the nature center. When I told that story, I mentioned that several of those ladies couldn't remember what they'd had for breakfast, but could remember fighting those politicians in the 1960s, because their memory of the long term was still preserved enough they could share those stories.
Before we conclude, I want to touch on one final subject that I think is particularly important, since we're doing this for the Center for Practical Bioethics. During your presentation, you had expressed some criticism of the current state of bioethics. What are your concerns, and what are the things that should be done to address those concerns?
My concern with what I call mainstream bioethics is that they have not been challenging enough of the agenda of medicine. They have not been active enough at not only exploring the value problems in the morals of medicine, but doing something about it. Money has flowed into bioethics from genetics, and bioethics divisions have been created within medical schools. So you get the money and the power structures influencing bioethics because of their affinity with medicine. It makes it harder to challenge the mainstream of medicine. My mentor in bioethics was a man by the name of Van Potter. He actually invented the word, and he was inspired by land ethics, environmental ethics. He talked about bioethics as a bridge to the future and a science of survival, because even back then he was becoming concerned about environmental health issues. And I think, and most bioethicists would agree, that bioethicists as a group have ignored environmental health and public health. So they haven't, the agenda, the focus has been where medicine wants them to focus, and not where we should be challenging our entire healthcare system, which is that its values are distorted by this sense that science can solve everything, and that there is a particularly growing concern that the environment is going to have much more to do with the health of older people than all of us through global climate change than any understanding of our genetics will contribute to health.
What kind of role can and should the Center for Practical Bioethics play in changing the bioethics landscape?
The Center for Practical Bioethics is a very collaborative organization, and we're doing work in Cleveland. I'm doing work with the Hastings Center, the Center for Humans and Values. So I think we need to create a conversation space, which the Bioethics Center here has done well around, for example, end-of-life care, around issues that relate to death and dying, but they relate to the huge issues of what's going to cause death and the dying and suffering as a result of climate change. I think it's very consistent with their message of improving care, but it adds to this dimension of how we're going to have to respond to these environmental problems. So I think creating conversation, creating open spaces, being willing to speak truth to power, allying themselves with other groups that are working in this area. Internationally, bioethics gets this. It's just in America that bioethics has been co-opted as much by medicine.
Dr. Whitehouse, thank you so much for taking the time to speak with us.
It's been my pleasure. Thank you.
Dr. Peter Whitehouse is a professor at Case Western Reserve University in Cleveland. Thanks for tuning into the Bioethics channel. I'm Anna Jaffe with the Center for Practical Bioethics.